All right, let's finish up the axial skeletal system and move on to the appendicular. This is the 25th and 26th bone of the vertebral column, the sacrum or sacrum and coccyx. And what you see here are, you see the superior or the superior wider portion that's called the base, and you have two little articulating processes. That is what actually articulates with the lumbar above. So you have this lumbar articulation with the sacrum, and then you also have the sacrum articulating with the appendicular skeletal system via the pelvis. So you have the sacral iliac. So actually the ilium portion of the pelvis. You can't see it as well here. This is a posterior view, but you see it a little bit better on the anterior view. And with the sacrum, just an FYI, is more curved in males and females. And its job is to protect reproductive urinary organs best it can. It's not really that big. And what you have are these holes, which they are calling, they're actually not telling you what they're called, these foramen, and they're the foramen that actually allow the remnants or the end of the spinal cord to come out. At the end there we call it the cauda equina, and it actually looks like a horse tail, and those nerves are coming out. This particular bone, and you can feel this on yourself if you feel basically right at below your low back, you can feel this bone. And the reason I say that is those nerves come out out the posterior aspect. So when you fall on your tailbone, whether that be your sacrum or your coccyx. Now your coccyx is probably not what you're falling on when you fall on your tailbone, but that's why it hurts like the devil, because the nerves are real close to the surface there. That's the sacrum. So the broader part at the top is called the base. The narrower part at the bottom is the apex, and the wings are the ala, and they are what's going to articulate with the ilium of the pelvis. The sacrum and the coccyx are unfused at birth, and so that's why you have what looks like a segmented piece in both of them. They're unfused at birth, and what happens is between puberty and say 25, all the bones fuse together into one in terms of the sacrum and the coccyx. Now understand, they are two separate bones still. The coccyx is very tenuous, can break off. Surprisingly enough, even though it's small, if it breaks off, it's very, very painful. And that can happen sometimes in childbirth, or it can happen with falls. And then you have a side view, and here you have the articulating surface with regard to the sacroiliac joint. And then also a curve. You see the sacral curve and the promontory, sacral promontory. So you see portions of the sacrum, very highly processed bone, sacrum and the coccyx. And so I think most of this I've already told you. It's just another view, which is nice. And then a third view. This is the anterior view, and with the anterior view, you can actually see these transverse lines where this bone was segments that fused together. Oh, those are sacral foramina, which makes sense. They're openings, and that's for the rest of the spinal cord to come through. And so the last topic we need to talk about is the thoracic cage. Your book is real interesting. It goes to great lengths to define things. And the thoracic cage is the thoracic vertebrae, the ribs, and the sternum, whereas the rib cage is the sternum and the ribs. Interesting. Um, but the rib and I have to apologize. I'm probably going to use thoracic cage and rib cage interchangeable. I apologize in advance. That's why I was telling you this. This is what your book says. Your book calls the sternum and the ribs the rib cage, and the thoracic vertebrae, ribs, and sternum the thoracic cage. But anyway, I guess you can't teach an old dog new tricks. So anyway, it's a huge amount of bones, and this is an anterior to posterior view. So what you're seeing is and this is looks like it either is trying to mimic actual human bone or it is human bone, one or the other. And you see that flat sternum, which probably most people are aware of what that is, and that sternum has three parts. You have a superior part called the manubrium, middle part called the body, and then a lower part called the xiphoid process. And your book says the body kind of looks like a tongue. I think the whole thing kind of looks like a tie, but your book says the body looks like a tongue. That manubrium is unique because you have that's where the appendicular skeletal system articulates via the clavicles. So you have that clavicular articulation. You also have the first rib coming in and articulating at the manubrium. So you have a couple of articulating surfaces on the manubrium. And then in the body of the sternum, you have, and these ribs articulate with the sternum via cartilage. We call it costal cartilage. And chondrocostal cartilage, and that is going to be cartilaginous material that comes in and forms an articulation, not so much a joint, but an articulation with the sternum. And you see the ribs here, you can see 1 through 10, and then 10, and then well, actually 1 through 7. You can see 1 through 7 here coming up and making and touching with the body of the sternum. So 1 through 7 touching the body of the sternum. They actually should have numbered it close to where they come in contact with the sternum. That's why we call those true ribs, because they come around and actually touch the sternum. 8 through 12 are considered false ribs because they don't touch the sternum. And then furthermore, 11 and 12 are called floating ribs because they don't come around the front at all. And so that's the rib story. Costal cartilage, that's what it's called, but it's chondrites. Then here's the posterior aspect. Now I'm sorry, my pictures are just diverting my attention because they're very, very interesting. This is the posterior aspect, which many times people don't realize that those ribs come around and form a joint with the vertebrae in the back also. The big function of all this is to create a cage, whether you call it the thoracic cage or the rib cage. It's to form a cage to protect the organs that are inside, and the organs that are inside are the heart, the lungs, the thymus, which is good to protect. Also to attach muscles for respiration. The shift in this cage size is what changes the atmospheric pressures between the outside and the inside and allows those lungs to expand. And also that it does allow for a place for the pectoral girdle in the upper limbs to attach. The back here shows you how those vertebrae, how the ribs come and articulate with the vertebrae via the facets. And you do see actually all of them, even all 12, you can see all 12 coming in and articulating, but you can see where you have 11 and 12, they're just floating. They don't go around to the front. And then remember 1 through 7 are going to be the true because they form a articulation with the sternum also. And then actually 8 through 12 are going to be false, and 11 and 12 are going to be false plus floating for the ribs. The other thing I wanted to say with regard to that xiphoid process, I didn't say anything about that. Remember, that was on the front view. That xiphoid process actually attaches to the diaphragm, which is interesting. And the diaphragm is the main muscle of respiration, and the rectus abdominis muscles. So that's an attachment for both of those, and it facilitates breathing because of that, because of that attachment. And then another little piece about the sternum, because it's kind of an interesting thing. It is considered a flat bone. The ribs are considered flat bones also, but they are kind of the exception because the ribs are flat bones with a head and neck and a body, which we kind of consider those terms with long bones, but they're considered flat bones. So the sternum's a flat bone. As I said, 3 parts. The manubrium is the upper part, articulates with the clavicles and the first pair of ribs. It has a jugular notch, which is an indentation between the clavicle and between clavicle articulations. Tongue-shaped, has the attaches tongue-shaped. The body is tongue-shaped, attaches to the manubrium and also the ribs 2 through 7. Then you have the xiphoid process, attaches to the sternal body, to the diaphragm and the rectus abdominis muscles. Rectus abdominis muscles, for those of you who haven't started studying your muscles yet, are those which are otherwise known as the six-pack. So attaches to those muscles via the tendinous sheath. And the sternum develops its actually 4 bones that are unfused. That fusing finishes is about 25. Everything happens at 25 with regard to the bones. I mean, everything's done at 25 regarding the bones. Actually, it varies based on the individual. And that, again, that lack of fusion prior to adulthood is where you have these transverse lines. And the xiphoid process is also easily broken. I guess the coccyx isn't so easily broken, but it can be. It can definitely be bruised. So we're talking about the pelvic area. So the coccyx can be bruised. It's the xiphoid process that can be broken, and certainly in the process of CPR or other things like that. Anyway, that's chapter 7, and we will move on to chapter 8. See you soon.